Before we even go to healthcare, I started by wishing everybody a happy new year. After wishing them a happy new year, you have to wish them a lot of success and prosperity this year. This year is going to be economically, the roadmap, the projections, the speech by
Roadmap. I'm
Nigeria's
tired of.
president.
I hear one more roadmap in my ear again. I'm tired. It's the start of a new year, and I'm very certain that everybody is back with that ginger. Yes, I want to put in effort into my business this year. I want to do this year. I want to do that this year. Yes, all of it is valid. Hello, everybody. It's your girl Kudirat. You're welcome to another episode of the Illuminate Africa podcast. This time around, we're going to be talking about a sector that is a little bit deep, so would appreciate you stay till or listen till the end of this. And per the usual, I'm not alone. With me in the studio is
Yeah, happy new year, everybody. Happy new year, everybody. It's Ochu Williams, and welcome to the new year. This new year, I have a new smile. I have a new shine. I
What
have
does
a
that
new glow.
mean?
It's 2025, and it's another beautiful year for you to keep chasing your dreams, keep making that impact. So I'm thrilled, I'm pumped up. I had a very good holiday, beautiful holiday, 30 December. I was among. So hope you were among 30 December, Kudirat.
Wait, first of all, how do you even put dirty December and I was at home in the same sentence? I'm going to ask you that one later. Anyway, for me, it was spending time with family, which is what holiday is about. Go to your family, go and spend time with them. Okay, love on them. So for me, it was coming home, seeing my family. It was such an interesting period for me. They took care of me, but that's basically it, Sha. So without talking plenty talk, let's go back to business, because honestly there's been a lot of things, as usual, pack unpack and scatter.
Before we even go to healthcare, let us. I started by wishing everybody a happy new year. After wishing them a happy new year, you have to wish them a lot of success and prosperity this year. This year is going to be economically, the roadmap, the projections, the speech by
Roadmap. I'm
Nigeria's
tired of.
president.
I hear one more roadmap in my ear again. I'm tired. I'm tired of roadmap.
This year is
Pushing the
going to
work up
be
and moving on. It's as
the year is
simple
going
as
to be
that.
successful. If you look at the projections and everything, so it's good. But in as much as you want to put in the work, you want to fight, you want to lock in. It's lock in season. You in doing all that, you have to take into cognizance your health. Yeah, your health is your wealth. That's what they say. Your health is your wealth. So, taking good care of yourself, putting your health as priority. It's so important in your quest for economic stability, to have more money and everything you want to do. So do not neglect your health. Try as much as possible to pay close attention to your health, your checkups. In Nigeria, we don't even know what some of those things are. Some people don't even go to the hospital as if until when they are sick. Of course, they pray, their pastor and priest and imam pray for them, so they are always healthy. But notwithstanding, taking good care of your health is always important. So
It's
today
very
we'll be discussing
important,
about
guys.
healthcare. It's it's a hard talk. It's a hard talk that we have to talk.
Yes,
Discussion
I
about
agree with you.
healthcare.
In addition to what you were saying, because you
This
kept talking about health, and do you know what kept running through my mind? The thing that kept running through my mind is Nigerians don't realize that resting is also part of healthcare. Do you understand? They don't. We work so hard. I feel like we work so hard as a people. We don't necessarily rest. And even if you say, "Oh, let me go to the hospital," like you were saying before. Let's say, okay, they've rested now, and whatever is wrong with them is beyond rest, right? So they go to the hospital to check themselves out, go through the doctor, have some tests done. It is not very affordable, right? And even if it is affordable, there are just some, I don't know, even I get scared when I want to go and do my health checkup. I don't know what causes that stress
it's
for me.
necessary.
It's necessary, but number one, is it affordable for everybody? That's my number one question. Number two, I don't know how else I'm going to say it, but trust. Honestly, whenever anybody tells me they're going to a healthcare center in Nigeria, I feel scared. I don't know if I'm being scared because not because I don't trust the skills of the doctors and nurses there. No, not like that. I get scared because I know that they're not being provided everything that they need to facilitate their operations as a healthcare. Do you understand? Now, don't get me
Yeah.
wrong, I'm not getting scared out of the fact that I'm not getting anxious out of the fact that, oh, I'm going to go to that hospital, the doctor may not know what's wrong with me, or the nurse may not treat me right. No. In Africa or Nigeria, as I will use as a case study, we one of our biggest exports is our medical talent, right? They are always very talented. If you've come across like a Nigerian doctor, Nigerian nurse, you know that they are talented. Now, my
That's
fear
the
is stemming.
that's the sector that has the highest jackpot. I think over the
Of
last 5 years,
course,
the record
that's what
is
I'm driving at. Do you understand? Now, you don't properly equip these people, you underpay these people, and then when they go on to open their personal healthcare centers, those, what we refer to private hospitals, the bills skyrocket. And why is that? Because they need to make back the money they invested into medical equipment. So it just makes the whole healthcare system in Nigeria and other African countries just -9. I don't know how to say it again, because these people are not well paid, the hospitals are not well equipped, and then I don't know. And it's such a crucial and important part of who we are and just the general well-being of the nation. Do you understand? You have entrepreneurs who are, going out there building these solutions to make sure that what we have work out, and then there is no proper healthcare system to take care of these people. You can't even take care of the people. Honestly, like I said before, is a hard talk, and I don't even think we'll be able to unpack it. So, Ochi, what has been like your observation in relation? Because I know you've been excited about this talk. So, what has been your
Hmm,
observations like?
I'm
And
excited
in
about
all
it.
I said, I don't know, maybe I'm too emotional about it, Sha. So I just need to know that I'm not the only one feeling this way about the Nigerian healthcare system or the African healthcare system at large.
If I would use one word to describe Nigeria's healthcare system, I would say no. Let me be patriotic. No, let me call it spade a spade. I would say shambolic. Shambolic. And me, I look at it from three different aspects. You know, the healthcare practices, the healthcare professionals, and the healthcare infrastructure. Three different phases. Let us start from the infrastructure. At least that is where it starts from, before we can go to the professionals and then the practices. Our health infrastructure, it's not good. If we look at public health care, and that is the healthcare for majority of the people. Public healthcare is like it should be accessible by like 80% of the public, even if it means government partnering like with private firms to subsidize healthcare. Healthcare is expensive everywhere in the world. We have to know that good and quality
Yeah,
healthcare is expensive, and that's where the government comes in. The government on
exactly.
like the government is not supposed to be the one doing all the job, producing jobs and stuff. That's entrepreneurship. But healthcare is like taking care of the citizens. Making sure that they are healthy to grow the economy. And that has been neglected, not only in Nigeria, in Africa, and even in other countries. But let's narrow down our scope to Africa. Our healthcare infrastructure in Nigeria is not good. I look at the public funded hospitals and federal medical centers, school of nursing and midwifery. People always crack jokes that the highest death rates are recorded in university teaching hospitals. Can you imagine? That is where they are growing the next generation of doctors. And why I've been to government's uh, health institutions before. I see how it's run. It's poorly run. There was one I went to, and there was an issue. And instead of the nurses going to look for the file, they started doing praise and worship. I don't understand. I know you love God, you love religion, but the
The
practices are
first new
simple.
word,
How do you leave a patient you're supposed to attend to, and then you start raising praise and worship? I don't.
I don't
And
understand.
that's an emergency case.
I understand, but I don't
Healthcare.
understand. I know what you're saying, but
Even
I'm
IT,
just trying to
even
picture
IT
it. Was like
is
the
funny.
patient, this patient, was this patient in an emergency?
Yeah, the patient will rush to the hospital, and the women are there doing praise and worship. I don't understand. To save the patient's life instead of giving quality health care, you know, for like
Because
times.
with what they are provided with, right? with what they are provided with, they will do the best that they can and trust God to, because when you don't have what you need, that's what I was ranting about in the beginning. Do you understand? They are not properly equipped. Do you know how expensive medical equipment or whatever it is, anything medical related is expensive, like you said before. And I, yes, I agree, it's not only in Africa or in Nigeria, right? It's all over the world. But what the other, these other countries that their healthcare system is working, you you would agree with me that their government played, if not 80%,
More than.
if their government put in 80% effort to ensure that they have that. Do you
The
understand? And now we're
infrastructure.
losing on both ends. Like we're just let me not say that, but we're just losing on both ends, right? Now our talents are traveling, because you said before they are the highest rate of people to jackpot. If it's you,
No,
do
no, 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 no,
you
no.
know how many years
Don't go there
they
yet.
spend?
Talk about the infrastructure first. I've seen Nigerian hospitals where people die due to lack of oxygen.
We're
The
saying the
infrastructure
exact
is
same
the first problem.
thing.
The practices and the professionals is another sector. But when we have the right infrastructure, then we can begin to improve. But we not having the right infrastructure at all. It makes, okay. For example, you are a nurse. In I cannot call the name of this hospital, but in a university teaching hospital, there was a surgery being done, and they were pointing torch. They were using torch launter to do a surgery. I know how
Now,
many times when in the midwifery houses they have to deliver a baby and they are using torch. They are going to borrow generator. No, this is the part the government has to be held responsible for. This is infrastructure. We're not even talking about the practice yet, the right practice. Our healthcare infrastructure, okay, look at the state of the government, the buildings. Some hospitals, they don't even have beds, they don't have mosquito nets. You understand? Like, let us have the basics first. Let us have a good healthcare infrastructure, a good, like, buildings, equipment. You understand? Then the policy. Okay, we have in Nigeria, we have the NHIS, the National Health Insurance Scheme. I think it covers diagnosis and some other things. But it's supposed to be available for predominantly civil servants and their offspring. I think so. But I've
why
gone
do
to
you say
hospitals
predominantly civil servants and their offspring?
because those are
Why that
the first.
demographics?
Is that's how it works according to the best of my knowledge. Civil servants are government servants. That serve the public. So
That's for the health insurance schemes. That's what you're saying,
yeah, for
right?
the National Health Insurance Scheme, it
Me,
covers
I'm
other people,
talking.
but I think civil servants have a bigger chunk of it. But yet still, it's not even effective. It's not effective. It only covers diagnosis to see the doctor after you have joined the queue for a very long time. Policies, practices, health insurance, buildings, equipment, dilapidated, not good enough. We have to improve on that one first of all. I know, and the private sector are doing good. If you look at the private hospitals, they seem not to be lacking these things, but yet still, the private hospitals that's entrepreneurship. Somebody's coming to provide healthcare for you. He has to make profits. You understand? Only the government can give it as a care and then get the money back through taxes. But for the entrepreneur trying to do that, he has to make profit. So it makes it a little bit difficult. So I would just like to appeal, let us have the right healthcare let us start from there. Let's build our healthcare infrastructure first. And then let's come over to the professionals. You said something before that they are highly skilled, and that's true. The highest jackpot rates. If you look at big hospitals, like globally, you see footprints of Nigerian doctors. There are lots of Nigerian students who go over to Bulgaria, Ukraine, Finland, like just for medical reasons. And those guys, they're not going to come back. That's the truth. They're not going to come back. So we raise those talents. They have the capacity. They go there, learn there, and they begin to offer healthcare services to those people. And then we are short on quality healthcare professionals. Now, we now have more people in the sector who remain as the bad eggs, like the ones who are not as good enough to run away. Because those who are
Not
good enough
as
to run
good
away,
enough to run away or not opportune to run away. Let's be clear on that. I don't agree
opportunity to
with
run
not good enough to opportune to run away, because I promise you there are really, really skilled doctors and nurses and all that stuff here in Nigeria, with just some of them wasting away, for the lack of a better word. Now, not because they wouldn't do what their peers are doing, if there's just no opportunity to, and now you are stuck in a small hospital where you're not even provided all you need to function right. So let's say you go to that hospital and that doctor, even though he's skilled, he knows what to do. If he doesn't have everything he needs to complete a surgery and then he just tries to improvise, no matter how much he tries, there's only so much he can do.
of course.
So it's a serious pain point. Because I'm looking at it from training point up until they are able to practice. Right, you spend a good number of years in school. Their fees not exactly cheap. You go through these different trainings and whatnot just for you to come out. You're underpaid, and need I remind you that if not the most important, sincerely, because they are in charge of health. So I really think that the government can do better. And I also think the private hospitals can do great as well. I understand you have to recover your, whatever things it is you spent on your equipment and all of that. But I don't know of any private healthcare center right now that has like a scheme, like a health insurance scheme to cater to like
Yeah,
the average Nigerian, right? Or like the lower class Nigerian. I don't think any of them do, right? Because just beside where I live, these Hausa people that are not, they're not very, I don't know how else to say this, they're not very exposed, right? So she was pregnant, and then somebody said they took her to one hospital like that, and then the doctor recommended traditional herbs for somebody who actually needed CS. She needed to have a
you can't
CS
you
section
can't pay
to
for
have
it.
her baby to give her. And then the doctor that is supposed to help her in that small local hospital, because he doesn't have what it takes to help, prescribes herbal medicine for her. So I'm saying that a lot of times it's not even the skill, it's the incapacitation. You are being incapacitated. You are not empowered to do what you are supposed to do. So it's about that pain. That's why they leave. Do you understand? They are on high demand. They leave because, of course, it's something that you have to practice, right? So the Nigerian healthcare sector or the African healthcare sector is just something you can really never blame on the citizens. It's a government thing.
Yeah, I spoke with some, like, nowadays insurance, and one of the best insurances offered are that of private hospitals, which is expensive, but not too expensive for someone who's in the upper class of the economy. And then I was like, but you could do this thing cheaper. Just he said it's not as easy as you think. I said, okay, okay, you only need to recover money spent on equipment. He said no, operational costs for those hospitals, like they run on diesel. Look at the cost of diesel now, and then healthcare machineries are not power light; they are power intensive. So what is the cost of running a generator to power the whole hospital? And they have to pay staff, and they have, he when he broke down the cost, it was reasonable, but
It's not cheap.
but me, I always tell them, like, you have to innovate. What you have to ask yourself, what is raising the cost of what you are offering? If you keep raising the cost, can people keep affording it? We need to keep people alive. Our mortality rate is increasing, irrespective of the fact that we have a positive, like, birth rate, because we have people, like, reproduction is high in this part of the world, but we have a mortality rate that is so high, especially in northern Nigeria.
All right.
Infant mortality, that's child, like the death of children. Infant mortality is like the most painful one. If you have the older people dying, aha, But when you are giving birth to the younger population, and there's a high death rate in that younger population,
And
is
then
very,
talk
very.
about pregnant women. That's the instance I was giving earlier, like the northern women, the ones that are not very exposed or educated, that don't know much about, going for antenatal, taking care of yourself and all of that. They are they are top of that list that you just mentioned as well. Apart from, child mortality rates, the that's because I just told you about a doctor that prescribes herbal medicine for a pregnant woman that requires CS. So I agree with you. They're actually like the biggest victim of this.
Yeah, and another, okay, let's shift ground to the healthcare practices. This is another controversial aspect. They when healthcare is standardized, right? If you're supposed to give an injection, there's a procedure. If you're supposed to administer a particular treatment, there's a procedure. How you take care of patients and all those things. There are procedures for all those things. In Nigeria, there seems to be, somebody said Nigerians are wicked people. But but it is written in the Bible also that the heart of man is desperately wicked. So it's not only in Nigeria, but
Mm.
the Nigerians took it to another level. They took that statement personal and they decided to implement it. Nigerians are wicked people in a way, because we've seen healthcare professionals deliberately flaunt the rules when it comes to healthcare practices. Deliberately. Some people do not care. Some people are only looking at it for the money. See, one of the things that come with healthcare is compassion. For you to be able to administer like healthcare services, you need to have some like epitome of compassion in you. We have seen people deliberately flaunt healthcare practices, and we have also seen some health professionals not even aware of the best healthcare practices to administer. So I'm asking, is there a training gap? Is there a knowledge gap in their training? Because some, especially the lower tier of healthcare staffs, not the doctors. The doctors in bigger hospitals, they are a little bit more responsible because they are more professional. Their licenses are hard to come back. But the lower staff, the clerical staff, the nurses, and some other people, the pharmacists also. Some of them have, okay, how can you explain a pharmacist selling expired drugs? Doesn't he know the impact? He knows the impact of what he's doing. And yet he's going to sell fake drugs because what? He needs money. Are we going to blame that one on toughness of economy or the wickedness of a human heart? I think it's the
Just
wickedness of a
breathe.
human heart.
There's no this thing that you said. There's no sugarcoating using fondant eyes to cover it. It's greed. It's as simple as ABCD. There's nothing else to say about it. In as much as a lot of times I always try to always point the light back at the government for the cause of a lot of things. As a people, I think we mentioned this in the last episode when we talked about mindset, right? Our mindset. You also mentioned something that you said something in relation to, oh, for you to be in healthcare generally, you need to have compassion, right?
Yeah.
This thing that I just mentioned does not only happen in healthcare, it happens everywhere. We see the slightest bit of situation as an opportunity to make money and gain money. It's just, do you know how many fake drugs are in circulation in Nigeria? Even the normal paracetamol that you take, there is another paracetamol that is above that paracetamol that other people are taking. You've not seen different kinds of paracetamol before. The same Panadol you are going to buy, let's say you go and buy Panadol. I don't know the current price of Panadol right now, but let's say you go and buy Panadol, like the regular normal Panadol that the average Nigerian knows that every Nigerian can afford. Let's say it's 1,000 naira, right? Oh, you're having headache, you go to the pharmacy, right? And then you buy Panadol for 1,000 naira. Do you know that Panadol that you are buying for 1,000 naira, there is another kind of Panadol that they call the real Panadol, that people who are in the middle class or elite take, and it's like 5,000 naira. It is so very different from your
I don't
regular
understand
normal
the
Panadol.
I could understand the pricing category for phone. There's a more sophisticated phone, and then there is a less sophisticated phone. But I cannot understand the pricing mechanism for
Yeah,
drugs.
no, you don't even understand. The content in itself is different. Do you not understand what I'm saying? the content, right? The content and the effect of the Panadol, they are different. The Panadol you get for 1K and the one you get for, I don't know the prices of, maybe that 5K own would have gotten to 10K now, sha. But the they are very different, very, very different. And you're like, how many Nigeria we dey? How many? What is happening? So now, in that case, you cannot necessarily blame the. I know. It's very easy. We often blame the government. See, sometimes it's not like I don't agree with you when you say, "Oh, let's not drag the government. Let's not." They are the cause of the issue. Me, I'll never let them rest. But you see, there are just certain things that it's not them. Because tell me why whoever is in charge of that decides, oh, we're going to, and then it's something that has to do with imports and exports as well. That we've spoken about that importation too. You have countries who, after they
Yeah,
finish selling what they need, they'll now ship the they'll now ship the substandard
you know
ones to us.
what
And we have
somebody
quality
said something.
assurance.
Somebody said something. Yes, somebody said something that the person selling the fake drugs, the person selling the substandard drugs, is the wicked person. Another person said no, the government is the wicked person.
They are
So
both wicked.
I asked
It's
how.
just
I
the
asked how.
mind.
The person said, everywhere in the world, there will always be fraud. Everywhere in the world, there will always be substandard. Everywhere in the world, there will always be people who will jump the process and try to do a bad thing. You know, but what makes the correct thing more outspoken is the regulators enforcing it. If the government or if the regulators who are supposed to monitor the sales of drugs are really up on their toes, we'll have less fake drugs. That's the truth. You understand? For
You
example,
see
I'll give
this.
you an example. I'll give you an example. There's a particular gold store, I think in Dubai also, where they sell gold. When you come there to buy gold, those guys will tell you that in this store you cannot buy fake gold. And you'll be like, well, somebody can easily pirate the gold. They tell you no. That every day the government officials come to check for who has fake gold. Like, if you are caught selling fake gold, it is better you never sold gold because the punishment is equal to the punishment of murder. Like, for selling fake gold. So if you are ever caught selling fake gold in that place, the punishment is equal to the punishment of murder. Everybody knows that punishment, and the government shows up every day to enforce it and still keep checking. Even after setting the punishment, still come to check to ensure that it is upheld. There's no fake gold there. It's the same thing for the medical sector. In as much as the regulatory agency, I think in Nigeria is NAFDAC, they keep saying no fake drugs, no fake drugs, no fake drugs. Yes, there will always be saboteurs. In everything you do, there will always be saboteurs. Jesus had 12 disciples. One was a saboteur, Judas. There will always be saboteurs in everything you do. But you have to stand up and squash those saboteurs because they are the ones that spoil the good work. There might be lots of people importing good drugs, but the fake drugs will always sneak in. And then for the common man who does not know what he's buying, he just wants to feel well. He's the person who bears the impact. And at the end of the day, you are giving fake drugs, you are killing people, and you are depleting the population that is supposed to give us advantage. It's supposed to rebound our economy. It's negligence on all factors. The saboteurs are there. However, the people who are supposed to checkmate them are not doing that. So it's a call to action for everybody. If you're a saboteur, please stop it. And if you are the regulatory agency, please, this is 2025, be on your toes, make sure these things don't happen. We need quality healthcare. We need our people healthy for us to go to where we are going to. So that's what I would say. And also, Kudirat, for you, I would say two things. You know, Another two things I think that are the biggest, and I will give it a, like you will say two also. Two things I feel that we should prioritize this year in terms of our healthcare is in the reduction of medical bureaucracy. There are people who want to impact these sectors. There are people who want to shake up these sectors. I know healthcare is a sensitive sector. It's a very sensitive sector. So there is regulation, lots of regulation, but there should not be over regulation. There's so much bureaucracy in the sector that people who are looking to come into the sector and offer better healthcare products, better healthcare services, they are left stranded. Healthcare is not financial services. Healthcare, it has to do with empathy, it has to do with compassion. So when we see people who are coming to impact those sectors, we're supposed to appreciate them. Since the government can't do that, then don't make it harder for those people who are coming to do. That's what I would like to say. And also, we need to cut down our underserved areas. There are areas in Nigeria that are underserved in terms of healthcare. I'm telling you, some local governments don't have a hospital. Then you are asking yourself, what is the federal government NHIS doing? Some local governments don't have a hospital. Some local governments don't even have a doctor. I've been privileged to go to some places in the north that where you are sick, it's either traditional medicine or they put you in a car and drive you to another local government 2 hours away from where you are to go and see a doctor. That is something shameful. It's something shameful, So our own focus this year we should be, let's cut down the underserved areas. But if you're saying let's cut down the underserved areas, who's going to go to those areas when everybody wants to jack back? Insecurity needs to be fixed so that people can access those areas and help those people. Uh, Logistics also needs to be there because sometimes people can't even go to those villages. So, and I know every local government in Nigeria has a local government chairman that the federal government gives money to. So what are you doing with the money? Help the people. So
Anyway,
for
a
me,
lot of those are questions that we do not have answers to. We know the answers, but it's not like anybody's going to come up here and take accountability for it. So what I'm going to say as a people is we've already found a way pretty much around everything, right? What I would say is to the private hospitals, this is not even for what the government can do now because they know what they should do. Only them know why they are not doing it. Na them sabi. To the private hospitals, please, I put please, can you guys work out a system that would favor the common man? When I mean common man, I mean like even the least educated and exposed person will be able to access even if it's an annex, right? It mustn't necessarily be in the main hospital or whatever, right? Just develop a system that will favor these people because it is quite devastating for somebody who is in need of CS to be giving herbal medicine when you actually need an operation. And also, let's double down on sensitization, right? It is sad that as at 2024, a lot of people still didn't know better. A lot of people still did not know where and how to go about certain health emergencies. And sometime in 2022, even at a, I don't want to mention this hospital, but like if you needed to see the trial and error, and we need to also move away move away from this culture of calling everything ulcer. Resensitize the people, go to make it a point of duty, go to these rural sectors, resensitize the people, put something there, and private healthcare sectors, put something together and help them. And then I don't want to talk to the government, it's exhausting. So basically, that's the two things I'm calling out, right? Resensitize these people, right? But even when you do resensitize them and there is no center for them to go to, there is no proper center that is properly equipped. So I think we should also do more of specialist hospitals, right? As opposed to like having the general ones together. Just have specialists, particularly for these small rural areas, these villages, right? Let's say for pregnant women, sorry, can you dedicate a program to them so that we can reduce this mortality rate, right? And also the healthcare professionals, I don't know, you need to remember your why at the end of the day, right? There is a reason that made you become a doctor, and most at times it stems from that compassion. I get it. Along the way you get hardened and you don't even want to do that which you're supposed to do. I quite understand where that is coming from, but whatever it is that your hand find to do it right, and do not hesitate to. Do you know, I hear a lot of news all the time, healthcare personnel saying that they've not been paid, even these private hospitals. that they've not been paid, they are treated like they don't
In
know. And
private
I don't,
or government?
private, private, like a lot of them on
Wow.
X, you see them every time calling out their hospitals, calling out their MDs, saying that they've not been paid for months. And I think that's why
And
even
also
when you
their
were speaking
salary
about
structure is poor.
exactly, they are not valued, they are undervalued. So this is an issue, like you said, this is a hard talk, right? Only a nurse, only a doctor can truly express the pain that they go through being a practicing being a healthcare practitioner in in their country, right? Only them can fully express what it is that they go through. You and I can only assume based off of what we've seen, right? Me, I feel like the healthcare practitioners, like our doctors, nurses, opticians, all of those good people, right? I feel like they are not valued, and we try to play this card of, oh, you became a doctor to save life and to also eat. Doctor needs to eat as
They are
well.
the real heroes.
They need, and it's so sad that there is not enough attention paid to these important people. I get it. Every sector is important. Every sector, because whether you like it or not, they contribute to the economy as well. They take care of your entrepreneurs. They take care of your other professions. They take your professionals rather. They take care of your lawyers. Take care of your accountants. Take care of, and I feel like anybody who is in that critical position needs to be happy. They need to know that they are well taken care of as well. Some people die on duty. Some doctors contract deadly diseases just from treating a patient, and then is there even see this you see this conversation, right? We are going to take it to them. That's what we're going to do. We're going to take this conversation to them. I promise you, you're going to hear stories that will bring out tears in your eyes. Now, all of this hospital, you were saying that they had to go and borrow touch, they have to go and do this, they have to go and do that. What do you expect? They will not borrow touch. It happens in everything. In everything. If you are to deliver a job and you're not giving everything you need to deliver that job, but me, I'll just say leave it. Don't just do it. But if you still say I'm not, see, it's a very complicated thing. However you look at it, however you choose to look at it, I feel like doctors should be like the highest earning professionals in Nigeria or any country as far as I'm concerned, because it's literally putting yourself, you are literally risking everything. You and I were seated now in front of our screens. When you're in tech, you are mostly on the screen. You are here. These people, real life, 12 a.m., 1 a.m., they're there, they're trying to figure it out. And kudos to them, sincerely. They try to work with what they have. And so that is why I keep saying that it is, in this particular case, it is the government. And then for those people in the pharmacy, you see, those ones is thief that is doing them. There's no other way to put it. It's thief, yes. And then but it's easy for them to thief now. You are inside lab. Then go and take care of a critical. You should go and do a critical, perform a critical surgery, and see whether you will have time to be thinking about pirating drugs. And then there is a market in Nigeria. There's a market. There's a market for everything. It's just exhausting. But today, guys, I know it sounds like, oh, these people, what's wrong with them today? They're just lamenting. They're just, that is it. Like what you said in the beginning, it's a hard talk. It's a talk that you don't even know where to start, what to tackle, what to deal with. But then yet you still need to draw people's attention to this, because it's very, very critical. We have not finished dealing with normal hospitals where you can go get proper treatment. You people are doing the other one. I don't want to go into that. You have not yet mastered how to treat somebody with malaria perfectly. Let them not come back to the hospital. You are going to open that one. I'm very sure you know what I'm talking about. Is it time? Because it's profitable. Do you understand? They know that people will give them money to do that. So it's a hustle now. You see, people that are supposed to be celebrated and treated right. They're not hustling. So they will tell you, they will trick you this and that for that and that to happen. And you give them your money now. So it's a hard talk. So guys, I don't know, drop your own comment, drop your own experience, that weird experience you had in any African hospital, that weird thing you've seen. Please share it in the comment section, because I promise you this conversation is not just for now. We're going to come back again and probably get a healthcare professional to come really really speak about their struggles, right? So just consider
We
this
need
as
more
an
than
intro.
one.
It's a hard
We need
talk.
we need lots of healthcare professionals. Though we need
Yes, will
the
you guys
healthcare
speak
people.
up?
We need
We need you guys to really speak up. Tell us what's going on, because we understand the pain to a certain degree. Because you have people with two different opinions. This one will say it's because they are wicked. I said no. As a doctor, you're supposed to show compassion. This one will say is this answer. You don't understand what those people go through. And the one last thing that I will just call out these professionals for: some of you are very rude. Those nurses and doctors, some of you are very very, particularly nurses, a
where is
lot
the
of you are,
empathy?
a lot
They say
of men,
empathy
a
is
lot
gone
of
because of the
African nurses
hardship.
and Nigerian nurses are very rude. A lot of you are rude. So sometimes it even makes it difficult for people to empathize with you. People, change your character, okay? Let me not go into fight mode. Let me just keep this conversation cute and short, because it's a new year. There's no need to start with blood and fire like that. When we, as the year progresses, as we begin to see things, uncover things, right, we'll put the right energy in the right places. Thank you so much for sticking with us in these last few minutes, just lamenting about our healthcare sector, because I think the reason we're lamenting so much is because at this point I felt a little helpless when we were talking about it. Like, can't we just do something? But maybe we are doing something about it. Who knows? We may just share with you guys what
Sensitization
we are doing about it,
first.
because we don't just come here to complain. You know that before we come and sit down and say, oh, there's something wrong, there is also a solution by the wayside. So if you want to find out, if you've been listening and you're like, now they complain, no, just relax, chop rice and relax. In our next episode, you're going to find out exactly what we are doing about this, and we very much like your support. We would really like you to stick with us through all of this. And then if you have any feedback for us, you can click the link in the bio, fill the form, and that is if you are a healthcare professional. If you're a nurse, if you're a doctor, a form will be linked in our bio. I'm going to leave it on there for like 3 months, so we'll be anticipating your feedback. Thank you so much, guys. I don't know if Ocho has anything to say, but it's peace out from me.
Thank you, everybody. We are so happy that this year we'll be able to do lots that will be impacting the life that we live on the continent. So before Kudirat has already said bye, but before I'll go, I'd just like to charge people who are passionate about healthcare, people who have the empathy, the private sector, the NGOs, the community, the whatsoever religious groups, and so just try to put in the work. Do the little you can do. Let's cut down the underserved areas. Let's help the sector, and a whole lot of that. And in our next episode, just like how Kudirat said, the healthcare sector is a sector we are taking very particular this year. So we will be having different guests. We're having doctors, surgeons, healthcare regulators, government agents, and even the masses who have felt the pain of our abysmal healthcare sector. They will have to come and share their mind. As collectively, we look to
Exactly.
go forward and we look to provide a solution. The aim of everything we do here is to provide a solution, is to
A
make sure that
solution. So
our
we're not
healthcare
just
is
people that are complaining.
please, it's not a rant show. It's a hard talk show. We talk about the challenges and we talk about the way going forward. We must begin to put things in order. We must begin to, and it starts from now. It starts from this sensitization. Telling people to take their health as priority. And then beefing everyone up in the sector to know what they're supposed to do. To those people selling fake drugs, please stop it. And that will be all for today. So thank you for listening, and in the coming days, we'll always have a lot to share and try to impact the lives that live on the continent. So, Kudirat, that's peace out from me, and I think that's peace out from you also.
After I said my peace out, you now gave another episode. Which peace out? Peace out. Come, my friend Gerard from this studio.
Have a nice day, everybody. Goodbye, everyone. Wow.
Omo. Shebi you don't stop to the record. I don't type
I'm trying to
what
end it
I've been
to okay,
saying.
end recording.